Welcome to Viva La Vulva, the podcast that explores and teaches about the goodness of the vulva. Here is your host, Dr. Cara Quant, an internal medicine doctor and advocate for female sexual health.
Medicine. Actually, going back to you, Colony, what's your story? What was the reason why you wanted to start PrEP in the first place?
Well, it kind of goes back a little bit in my family. My grandmother ended up dying of dementia, and we found out that it was syphilis-induced dementia. My grandmother was a saint. She'd been with one man her whole life. So later down the history, we found out that my grandfather cheated. Of course, back then, she never thought to go get tested. And it was really tragic to see that. Fast forward, working in different hospitals and seeing how there are patients who don't disclose to their partners. We see their medical records, and that always alarmed me and made me think, sometimes we're not even honest with ourselves. We're not being honest with other people. We got to be responsible for ourselves. So I had entered a relationship where my partner had cheated, and in lieu of that situation, the concern was the ST. My big concern was not something I could take a pill that was treatable. It was HIV. And so while I was waiting the few days to find out what was happening, my brain just spun out of control because I'm kind of an anxious, analytical thinker, especially when it comes to my health. Very health conscious. And, as I was running down the rabbit hole of what can I do in the future, because obviously I'm going to have to work on my trust issues, but I want to be able to be in relationship. Also, I'm sex positive. I understand condoms break, and I just want to feel like I have some type of control. I came along PrEP. I remember a coworker talking about it, and I did more research. My doctor has had no other patient ever bring it up to her whatsoever. I am her first. And so she said, I trust you to do some research. I'll do some research. We're going to do this together. Let me know how you feel. And really, she kind of advised me to talk more with one of the advocates for PrEP about it. Now, the interesting part about this is I couldn't, even though I had stellar healthcare insurance, my insurance wouldn't cover it because I was not, the typical person asking for this medication. I was not at high risk, according to them. I feel like I am at high risk if I'm being exposed through my partnerships. So I said, fine, if I have to pay out of pocket, I will. And I'll go ahead and go back and advocate for myself because I will make sure that this gets heard. So somewhere in the mix, I didn't have to do all that. My insurance went ahead and authorized it. And so I continued to take PrEP. I got into another relationship. I decided to go off it. Same thing happened. Trust was broken. And I just really kind of spiraled, and I thought, oh my gosh, this just keeps happening. I already knew the statistics of heterosexual women who were thinking that they're with one partner becoming some of the highest numbers to get HIV. And, I guess I could speculate the fact that a lot of the research that I read is a lot of, men that are not disclosing that they have preferences for both sex, and I just felt really lost and just decided, what, I think at this point, until I am really, I don't know if I'll ever decide that I want to be off of it. That's a whole nother issue for my therapist. But I'm just really grateful that at least I have this option, and, we'll just deal with the rest later.
Yes, I'm so happy that you advocated for yourself and you're like, I want to take this medicine. Insurance company, authorize it. Let's get this going. Let's get this started.
It was like a form of reverse of a racism. I was like, this is a weird type of I don't think so. You're messing with the wrong girl over here.
And your doctor is a primary. You were talking to your primary care doctor.
She just. I live in San Diego in a pretty medium, moderate household income, and it's just not something that I guess is being brought up. But what I do find is being sex positive and having been out of a marriage, so now I'm a little bit more open with my sexual practices. I'll be honest, I have every partner that I'm going to be fluid bonded with want to go get tested, and I'll tell you, 10 out of 10 times, this is not an issue, at least in heterosexual relationships, that any man has ever really. It's it's a first. So I do advocate also amongst a lot of my girlfriends that are single. And I'm sex education has changed so much over the years, but there's new stuff that we have to really be aware of. And only we can be responsible for ourselves because everyone else is old school thinking. She looks good. She looks healthy. She looks fine. That's just not okay. You know what I'm saying? It's not okay. And, the only question any of my partners ever ask me is, are you on birth control? That's the least of my worries. Getting pregnant.
All right. Yes.
My
No,
word.
and let's have this other conversation.
Yes.
Wow. Yeah, I do see that in talking with patients and asking them. Many of the patients who come in and want to be tested have already had sex with a person unprotected. And so they come in after the fact and they're like, I want to get tested now. And I'm like, okay, well, yes, we can test you. I will order the test. But did you have a conversation with this person as to their STD status? Like, when is the last time they were tested? Have they ever had any STDs in the past, or been with partners who have had STDs? Like, when is the last time that you had this conversation? And I would say most of my patients have never brought up the conversation with their partners, like with their new partners, of when is the last time they were tested.
Never.
Like,
I'll message you and I'll be like, how do I have this? Because even if I have it with all my like long-term partners, it's awkward because my partners make it awkward. I really feel like if I'm gonna let you into my body, this should be the easiest conversation we have. But I guess we're just not thinking like that anymore these days, So
Yeah. I was going to direct this question to Lachey. Is there, as a sex educator, is there a script, or is there something that you have that you tell people of how they can have a conversation about STDs or STIs and being tested?
Yeah. So one, I want to say, I think conversations like this are really important, because I think when people and women, especially Black women, see women that look like them, they're like, okay, well, they're having these conversations with, their partners. Okay, that means I can do it too. Cause that's the experience that I've had is amongst my girlfriends, I'm telling them like, yeah, girl, I made him go get tested. Like, they're like, well, you did? How did he respond? And I'm like, or even if it's in a text, right? So what I do and what I encourage people to do is, one, know your partner, because everyone has different communication styles. Anytime someone asks me for a very specific script, it is literally based on the type of relationship that they have. So for example, I had someone recently, ask me, hey, how do I ask my partner if he's using protection with other people? I do not mind. We're not monogamous. So non-monogamy is a practice that a lot of people are exploring. And so I gave her a script and I'm like, just let her know, hey, I'm not concerned with you having other partners, but based on my concern for my sexual health, I do want to know if you're using protection with them and how often are you getting tested? And she was like, okay, that was good. I'm going to copy and paste. So she just copy and pasted. And for myself, I lead with vulnerability because I'm going to physically share my body with you. I'm going to first talk to you about what my body is like, how it responds, how it reacts. And what that looks like is I'm like, hey, I'm sensitive down there. So if you sleeping around and we don't use a condom, I'm going to get BV. I might get a yeast infection. Like and they like, whoa, they're like, okay. They're like, and I had someone like, how do you know this? And I was like, because when I had a partner, they slept around and this was the result of them sleeping around when I was not. And they respect it. And they're like, okay, so she's telling me about her body. I don't, contrary to popular belief, cishet men feel really bad when you tell them that they did something wrong. So you're like, if you do this to my vagina, baby, we're not going to be able to do it. Now I'm going to be out of commission. We can't have sex. We can't enjoy it. So before we get to that point, let me tell you, we are going to go get tested. And then we're going to talk about how we want to navigate our sex life. Are we choosing to use condoms? Are we going to be primary partners? Are we going to be each other's only partner? What does sex look like for you with me? I have my preferences. I lay them on the table and then we negotiate. So I do negotiate my sexual practices, and I haven't had a problem. I have not had a problem with any man having a problem using a condom or getting tested with me. So yeah, I think the more we talk about it, the more open people will be to having the conversation.
Lachey, do you go as far as just taking their word for it? Because this is the other thing. I'm a show. I don't even want someone to trust me. I want you just to see it. You know what I mean? But I have never, not unless I go in with someone, people will be like, oh yeah, I got tested. And it's like, I would like to see that. It's like, how do you go?
Oh yeah. It's either, the phone results, because now you can get them on your phone. Like if you have Kaiser, you can do mykp.org, everybody. If he has Kaiser in California, don't let him play you, okay, Mike? Yeah. He can download it on his phone. Planned Parenthood also offers free STI screenings. If he doesn't have health insurance, that's already a concern right there. But yeah, no, I asked whether you have to bring it in person on a piece of paper or we go together, which I don't have a problem with. And if time doesn't permit, there's too many creative ways for us to get STI screenings, which I do want to say this, and I do have to say it. Nicole, I appreciate you so much. And I know we might not be ready to segue there now, but during the pandemic, I was able to order a free at-home STI screening. It was specifically for HIV. And it was an easy kit. I ordered 2 because I was like, look, just in case I mess up the first one, let me get another one. It came with condoms. It came with very clear instructions. If you couldn't read the instructions on a piece of paper, they had visual instructions that you can access through your phone. But I was really grateful because it was private. I was able to do it safely, during the panorama. And yeah, so I definitely appreciated that, Nicole. And it's something that when it clicked back, I was like, you know what? Everyone needs to do this. I was like, I did it right the first time. It was great. I'm like, I had a second one. So I did the second one recently and I was like, okay. I was like, I'm cool. I was like, I'm good.
Right. That is so awesome. I'm glad you was able to benefit from it, that resource. I'm curious to know, if you don't mind, you mentioned sex negotiation, that you negotiate your sex. Like, how do you, that just hit me because I know as a young woman, and not just a young woman of color, but a woman with darker complexion skin that, when I grew up in the 90s, I wasn't necessarily as desirable, right? So I didn't have sex negotiation skills. I was promiscuous because I wanted to feel wanted, by men. So even in the landscape today, how do you build the confidence to negotiate your sexual needs in such a vulnerable way? And what advice do you have for other women to feel confident in that way, especially women who may be in situations where they have to use sex for survival reasons, right? They're living with a partner who's taking care of them and so forth.
Yeah.
That's a great question.
Yeah, and I had a very similar upbringing. I'm dark-skinned girl, grew up in California, not the most desired for relationships, but as you get older, you fill out, men will be men and they want to have sex with you. But I switched my perspective around that because I'm like, oh, he's a man. He wants to have sex with me. Okay. If I open my mouth, which for a very long time, it was difficult for me to do. Very. And just like, how do you pronounce it? Colony. Just like you, I was married as well. Trust was broken and violated. My first thought was, I have children and I do not want to put myself in a position where I compromise my own sexual health. And then I'm getting older as my kids are getting older and I'm telling them that their mother is sick. Right. So that became my why for my sexual health. And when I changed my perspective on, well, men want sex, and I'm like, okay, and if I want to have sex with this man, we're going to negotiate, because what are you going to do? You're going to tell me no. You're not going to tell me no. You want to have sex with me. And that's just kind of how I changed my mind. I changed my perspective. But I do think that for women who are in situations where they are giving sex to a partner because they have to live with them, or they're financially providing for them, I think we would encourage them, and I would encourage them to talk to a medical care provider or someone along the likes of us ladies here to help them with PrEP. I think that they should start on PrEP as well. That's a sticky situation because outside of HIV/AIDS, you can still catch other things. VV is very common amongst people who have multiple partners. Yeast infections happen, and those are very irritating and not very pleasant to deal with at all, right? You still have syphilis, you still have gonorrhea. So in those cases, I think that keeping yourself safe as best you can with the proper medicine, and then from there, tapping into other resources outside of just sexual health resources so you can get out of that situation.
And, what about even the people who don't even feel that they should be tested? Like, what if the people who are like, I'm in a stable relationship, like I am, like we are married. I don't need to be tested. I don't need to be on PrEP or, like I don't need to be doing this stuff because it's a stable relationship.
Well, I think the reality is that the numbers show us otherwise. One of the very first things I learned in sex education was the rates of HIV/AIDS in Black women. It made me cry. That was the very first thing that I learned studying sex education. And so the numbers don't lie. And because the numbers don't lie, we can't lie to ourselves. And if you don't protect yourself and love yourself, you could find yourself in a situation where, like I said, the worst thought for me was, I have to tell my kids as they're getting older, I'm sick and I might not be here if I don't have the proper care, right? Because if you don't have the proper care, you can't live with, HIV/AIDS. It's going to be a difficult road for you. So I think that women taking care for themselves and taking care of themselves has to be on the forefront, or people in general. Even if you're in what you think to be a monogamous relationships, like I said, numbers don't lie.
Yes. Yeah. And as we were bringing up earlier, that even though Black women usually have less partners, usually use more condoms with their, with sex, but we're still having the higher rates of HIV. So there's something not right. There's something going on that we're missing. And yes, being tested on a regular basis or somewhat regular basis is, I feel, very important. I think every person should be tested who is not in a relationship, who's single, should be tested every 3 months. And for those people who are in quote unquote monogamous relationships should still be tested. Maybe not every 3 months, maybe yearly, but I still feel like they should be tested. So I know, Lachey, you have to leave, get out of here soon. Or now?
Yeah, I'm be heading out.
Before you leave, if you can just let people know how to stay in contact with you, how to get services from you, how to hear more from you.
Yeah. So if you guys want to find me, you can find me on Instagram as ShaeIsLove, ShaeIsLove. There's a link in my bio that directly links you to my website, www.shaedaily.com. That's ShaeDaily, ShaeDaily.com. And this summer, I will be opening up my coaching services again. Mostly work with couples, but I'm going to be working with Black women this summer. So I've kind of scaled down just a little bit. I don't have the capacity for everybody right now. I have to focus on the community that I really want to serve, and Black women are my why. Yeah. If you look.
All right, Black Women Summer.
Call me. You need to tell him you need to get tested. Okay, it's a Black Women's Summer. 2020. What we doing? But thank you so much for having me. It was a pleasure to meet y'all, ladies. Nicole, thank you. I cannot thank you enough.
See you soon.
Thank you, Lachey.
All right, yeah, see y'all soon.
Bye. So to get into the discussion about how people can be tested more regularly. So say they don't have the resources or a clinic that is very close to their place where they could just go in and be tested quickly. They have to take off work. They have to, there's complications to being tested. You have to go to a lab. You have to take time off if you're working. So you and the organization that you are a part of has made it more accessible for people to be tested. And I think that is dope. Like everyone should know about this. Like everyone should know about this. So tell people what it is, how they can be tested on a regular basis.
Absolutely. So through folks, if you want to get tested for a free, not only just HIV testing, but full panel testing, the full panel lab-based testing is available in some jurisdictions across the country. However, there are other jurisdictions who don't necessarily have the funding to provide free full panel testing, where CDC has provided funding to supplement those counties. So now anybody who resides in the US, you don't have to be a documented resident. You can be undocumented as well, as long as you have an address that you can get your kit mailed to. You can go to havegoodsex.org. There's a link there that will take you to say, order my kit now. It'll ask you a few questions to put in your zip code, address, and also the last time that you've been tested. If you've never been tested, or if you've been tested more than 3 months ago, you will qualify to get a testing kit. If your zip code is not in a jurisdiction that offers the full panel testing, it automatically redirects you to the national site. So regardless to where you're at, you'll have the option to get a free testing kit. Now, the difference between the two is this. Here in the Bay Area, San Francisco County, Alameda County, I believe Santa Clara County, and Contra Costa County, they are counties that have bought into the platform. And so this agency called Building Healthy Online Communities, they have provided us with the technology to do this service, because this has always been a challenge and barrier, especially for the public health, on the public health side. And so it's the first time we've had lab-based testing. And what that means is that those tests are processed in a lab, and the results are then sent back to the client within a private portal, but it's also connected to our Links Navigator team. So when you send your results in, there's a kit that comes in for the HIV test. Instead of doing the oral swab, you have to do a finger prick, which is a dry blood spot. There's also swabs in the testing kit, which allows you to do 3-site swab. So if you oral swab, rectal swab, and vaginal swab, no urethra swab, and we do not collect urine. So it's only for those who have sexual contact in those 3 areas. Then there's also a finger prick for the syphilis. You have the option, depending on how you respond to the questions, to get a Hep C test as well. And all of those tests, you then package it up. It's easy. Drop it off in the mailbox. It's a confidential ID number, so your name is not on the box at all. It's kind of like a encrypted barcode, and then all your results will come back to the portal. And additionally, for those who will test negative as well, there will be information that's sent to you to offer you PrEP. So people are being offered PrEP through this service as well. So even if you don't know about PrEP and maybe PrEP is not for you, everyone should know that PrEP is an option, right? The national kit. So it's different from the national kit. If you live in a jurisdiction that's not participating in the full panel testing, you will get an oral quick test. And so that is an oral swab. The difference between the two is that you swab your mouth and you get your results in 20 minutes. So when the individual gets their results, we rely on them, if it's positive, to contact a provider, whether they have insurance. If you don't have insurance, we rely on them to contact their local STD clinic that's free, to let that provider know that, hey, I took an at-home test and it's positive. And like you mentioned, Dr. Carr, then they will conduct a confirmatory test, which is inclusive of the RNA. But with the lab-based testing that you get, the RNA has already been processed at the lab for you. And so the goal of this program, too, I just want to mention this and why I'm so excited that this team with Emory University and Building Healthy Online Communities I want to point out is that we can eradicate HIV without having a cure. And this is why, right? We got these 3 prongs. If everybody in the United States, let's just start with the United States, this country, was tested at least once, right? So that means everyone in the US knows your status at a snapshot, right? So everyone who then tests positive, they're connected to care and they're consistently on their antiviral medications, right? So then viral suppression is down, which prevents HIV acquisition. I mean, it's like less than 1%, right? That you're likely to transmit.
Yeah.
And then you have folks on PrEP, right? So now you're building an entire country or population where everybody is taking their antiviral meds. The folks who need PrEP are on PrEP, right? And then you have people getting tested every 3 months. We can essentially eradicate HIV without even having a cure, just through screening, PrEP, and antiviral medication adherence.
Yes. And I do want to say that you're not getting paid for Truvada or from, Apertude. We are not getting paid for these places, these drug companies to talk about this. This is more of a conversation for Black women and HIV from the statistic from the CDC. So we are not getting paid for it. But I do believe that, that's a great solution. And that is a way that you can be tested all the time. You can have a kit that is sent to you. You don't even have to go anywhere. Like, you can have it sent to you. You can be tested. You can send all of the testing, the blood sample and the swabs to, if you're in that certain location, to the lab to be tested. That is the way that you can be tested on a regular basis. So single people out there or not, you can be tested every 3 months. And I was talking to Nicole about them, putting a feature on there where you could just get the kit test sent to you automatically unless you opt out.
Yes, yeah. And then you saw the dating apps, Grinder. So the dating apps that cater to the LGBTQ plus community, specifically gay men, you go to their apps, there's a button that says order HIV test, and it takes you straight to the Take Me Home website to get a test. Now just imagine if we can get that on all the dating sites.
On Bumble.
On Bumble. Plenty of fish. Dating app, exactly.
Facebook.
Right? Facebook dating app.
Simple. This is as simple as look at the accessibility to birth control. It's just as simple. And honestly, birth control, I feel that way more than I feel this. So it's like you want to take control and really have a little bit more peace of mind. I think this is really a good answer for now. Hopefully they'll be better.
Yeah.
So.
Yeah.
Yes.
And we will be offering, Colony, you mentioned, so folks, for PrEP, there will be a PrEP option eventually that's rolling out in phase 3, where you go online and then your clinician, you would have already had a tele visit, like Dr. Cara is prescribing me PrEP, but I don't want to go to the office. So she, you do your questionnaire, the conversation we have, and you provide me, you're part of the provider network that's connected to the home testing program in your jurisdiction. You give me a code. So I'll log in and say, I want the PrEP panel.
Okay.
And so now that PrEP panel is then sent to me, which includes the creatinine testing as well. So now I'll do my testing at home. You get the results and you send my prescription to the pharmacy. Now I can get PrEP without even coming into you. Then we have pharmacy delivered PrEP that rolls out. So if it's injectable, you can then send that injectable PrEP option to the pharmacist. And the pharmacist, there's legislation coming down the line where pharmacists, they already can do point of care testing at the pharmacy, right? Now they're going to be able to do administer injectable PrEP. That's the next phase. So again, creating more accessible options for folks. Generic PrEP is rolled out already. So Colony, you have to go through that advocacy with your payment, and PrEP at one point cost $5,000 a bottle. You remember that time?
It was very expensive, but I was willing to pay. My life is priceless.
Exactly. And now we got the generic, and so it's slow rollout, but we're getting there. We need folks like you, Dr. Cara, that is just putting this out there on the platform to have conversations about it.
Yes. I am a complete advocate. I mean, obviously we are doing this podcast. I mean, I wish we could talk for hours about this because I really do feel like the more conversations we have, the more likely people are going to take this medicine, to take Truvada or to do Apretude, which is the injection, on a regular basis so that they can reduce their risk of contracting HIV.
Or at least to have the conversation of STIs with confidence and be more aware of how important it truly is. Just because we ignore something doesn't make it not be there. So we got to empower ourselves as women. We're the one, we hold the cookie. We got the cookie jar. We got to open up the tray.
I like that.
Like we do. We hold the power. We do hold the power. And so, yeah, that conversation of, hey, when is the last time that you were tested? Let's, have unprotected sex, but let me see the results of the last time that you were tested. Like that is, that's definitely a goal for everyone.
It's not so much that we have to just be aware of like, oh, we're going to go. Well, I think a lot of people might still go into it, wanting to use protection. Condoms break, so it's a lot to think about, but, it shouldn't have to be.
Yes. Let's drive these numbers down, especially for Black women. We do not need to be a statistic. And with the organization, with the Good Sex campaign and giving the option to get tested on a regular basis at home. You don't have to go to a clinic. We have the tools. And we can definitely empower ourselves to know our status and to reduce our risk of HIV.
I have a question for you, Cara. I know you read the questions, but I have a question for you since you're a doctor.
Yeah.
I find how do we get and I'm an advocate for patient care. That's what I do as an OT. So I'm always opening my mouth. This is the first time in my life I've had to advocate for myself a lot, right? So how do we get doctors? I'm lucky. I choose my doctors. I really look at their background and I try to get some that'll work with me. But what about how do patients get doctors to be open-minded to exploring and learning more about these things so that they can work together, to, understand their options?
Yeah, that is a great question. I believe that it is up to the patient to just be open and be like, hey, I heard this podcast and I'm interested in starting PrEP, or like, I feel, either I'm a high risk person or I'm a Black woman. And I know the CDC statistics from 2020, like look it up if you don't know it. I have an increased risk of getting HIV, even in, as a cisgender, even in a heterosexual relationship, I still have a higher risk of getting HIV. So let's talk, or I want to get PrEP. Like, I want to be like, let's start the testing. Let's start the medicine. It's your health. Like the doctor or the provider is the conduit to, get tested or to get the medicine, but like, this is your health. Like, you have the power. Ask for what you want at the doctor's office.
Right. Colleen, I also think, just to add to you, Dr. Carr, that it's the responsibility of the health department as well. Because a lot of times the health department is providing information to private entities like Kaiser or One Medical, and we receive these data from clinical trials and so forth. But the health department has a role and a responsible of communicating these resources to the community so that they then could have the information to ask their provider, whether it's in a private setting or a public setting, for these resources. We also have the responsibility to do academic detailing. And what that consists of is public health providers or clinicians providing education to other clinicians about these new resources in PrEP. So I'm sure, Dr. Carr, there was another clinician or somewhere in Kaiser where they're training you on the PrEP protocol, right? So that's academic detailing. And I think academic detailing needs to be a priority across the board. Like, some counties, San Francisco has the funds and means to do it, but academic detailing needs to span across the country, bringing providers in all sectors of practice, not just infectious disease doctors, because they know about PrEP. All infectious disease doctors, you go to them, they're prescribing PrEP way ahead of folks who are in pediatric or internal medicine or general medicine, right? And so there needs to be a standard of academic detailing across all medical systems as well.
Yes, Nicole, I agree with that, because right now, I can even say across the board, there are certain places that put it to the infectious disease doctors. So if you want to start PrEP, I will do a referral to infectious disease for you to start the medicine. Not, I can, in the same setting, in the same like clinic visit, we can do the test, and then, once the results come back, start PrEP. It's let's do a referral and wait and see. So there are there are many doctors, including myself, that was never really trained about PrEP. I had to get the resources. I had to get the information, empower myself about, like, okay, what is the testing? What is the follow-up? What are the side effects of the medicines? Like, that is research on my own.
Thanks for joining me today on the Viva La Vulva podcast. I am your host and internal medicine physician, Dr. Cara Quant. If you like this podcast, please let others know and subscribe. Also, if you want to hear more information about what's happening with Viva La Vulva, hop over to our website at vivalavulvala.org and sign up for our newsletter.